I am Dr. Joseph Caruso. I'm a prosthetist in Chicago, Illinois, and also I'm the prosthetist at Stroger Center of Cook County in Chicago. Hana is a patient of mine for the last 4 or 5 years. The patient had an unfortunate accident many years ago and lost all of her teeth, maxillary mandibular teeth. As a result of the traumatic injury, she had atrophy of the maxillary arch and the mandibular arch. Preliminary x-rays did not reveal sufficient quality and quantity of bone for any implants at the beginning of treatment. As a result, after proper CT scans, we decided to use autogenous bone. Autogenous bone is from the patient themselves. And so in Hana's case, we prepared her for surgery. Took grafts bilateral from the hips. What I'm doing is turning on the Ostel unit, okay? What I'm doing is an example. I'm going to ask you, Dave, if you see this up on the screen, this area. This is a sample here, analogous to a peg that we're going to put into the implant, okay? So here's the implant, and here is the peg that I'm going to screw in, and I'm going to hand tighten it, okay? Resembling an implant. So I'm going to place this probe right next to here, and it's doing this electromagnetic, and what does it say, 70? Right? Could you see that? On the screen? Okay, you can't see it. Can you see that? Okay, is it read 70?
You can't see it.
They can't?
Yeah,
maybe just...
In other words, what you want to do is maybe I could hold it this way?
Perfect.
Okay, so the probe is here, okay, this little peg, right? And so what I'm going to put this is the implant, and it read 70. Now, let's say that the implant was loose, okay? Or wasn't fully integrated. So I'm going to loosen this peg in that area, okay? And we have a loose peg implant. What does it read? 28, okay? You see this?
Yeah.
Okay, so that's indicative of the stability of the implant in primary stability or so. So that if I tighten it just a little bit more for illustrative purposes with it.
Dr. Caruso.
17, okay? So you could see the point that I want to make is that depending on the stability of the implant, whether it be initial stability or after integration, we could get different readings. And this gives me an idea of when to restore. Now what I'm going to do in Hana, for simplicity, because I'm not going to do this throughout the whole 10 units, okay? Because I think the protocol, the procedure is going to be the same. You're going to see this. So I took one of the healing capsules off in the bicuspid, chin a little higher now. And what I'm going to do here is to place the magnetic peg in, hand tighten it. All right, good. And then what I'm doing is here putting it right over close to the buccal lingual. And I get a reading of 69. You don't have to see that, but it's 69, okay? Then I'm going to go, as I mentioned, mesial distal because the bone is a little thicker there. And I get 68, okay? So we got a good integration of the implant, okay? And then start taking the healing abutments off. Oh, do you want a little bit of Novocaine on that back one? Let's go ahead and take off the abutment. Later I will show you, but I'm not going to take this off here. She has 5 implants on the lowers, 4 implants on the lowers, with a CAD-CAM bar with 3 locator attachments with Veneers teeth on the lowers. So you just to take a look and see if you could see this, okay? Just one in the audience tell me, could you see the implants?
Yes.
All right, and they may not be as clear as I see them here, but the tissue response is very nice, maintaining nice oral hygiene. Now, what I want to do is to show you when you're doing multiple implants, and you're getting engaging custom abutments, with a system that has the internal hex system, you need some verification jigs. And Hana, give me one of these here. These are the verification jig. And Luke, could you just describe them? You have them numbered, is that for me?
Yeah, we made verification jig from GC pattern, the wax. We made two split together. Then I put down the number, which is back side, the tooth number. So Dr. Caruso, after put it into a bottom in the mouth, then he can double check it's the right fit.
And it's important to do this because you're going to see a little bit of, I don't think of a problem, but if you don't have this jig, then literally the orientation of these abutments maybe a little, hold this up here, Hana.
And also our implant abutment, facially, we make a straight line for facial area. And the back side, we try and put the number in case you lose it.
Would you help me doing this? Your chin a little. How that we hold this in here, and Aida Lou, do you hold this with me? While where are we?
Joe, can you talk a little louder?
Oh yeah.
Okay.
What I'm doing is orient this jig in the mouth, and okay. If I get one of the screws set, then we're fine. Okay, so you're gonna have once I get the first. Okay, so the first screw is in, and I'm not going to remove these jigs until I finish with all of them, okay? And it's really tactile sense in terms of getting into the screw itself. Now I do it hand tighten until, you know, you can't say how many Newton centimeters my hand is, but we're going to torque these in once we get it. Hana, are you okay on that one? So we have a verification jig, and he called it 13 and 14. So now we'll go over, and you notice that I'm putting it in 2 and 2 so that it'll make it easier. And every time I drop it, I call Hana's. We'll go into number 11 and 12, right, Luke?
Yes.
And this pattern, could you just describe the pattern as I go into the orientation of this? Sometimes I don't talk while I'm oriented. If you could just talk about that pattern that you use. What is that resin, that one that we used this morning?
Well, that one is GC, the pattern, the wax, but when you use in the mouth, then you're using Primatech pattern.
This is
It's a little
Primatech?
different, yeah. No, this is GC pattern is way better in the mouth.
This one here?
Is our side, laboratory side. Yeah. And also I extended the pattern a little bit toward more gingival, but I don't want to put too much gingival area, then get too thick.
Explain why we did that the other day, okay?
I better careful about the margin too. I cannot extend it all the way margin sometimes, otherwise margin is popping out. We don't know the fit exactly.
Okay, let me have the screwdriver.
So we educate our lab technician also because we can see easily, but we don't understand how hard it is in the mouth. Bleeding and saliva, and it's tough.
And also the access. Sometimes, like in Hana's case, it's fine because we have good access in her mouth. She doesn't have limitations of opening. As I said, this is internal hex, okay? So there's 6 positions that we have to place this in. So sometimes the positioning of the abutment into this hex, I could do it freehand, but I would rather have the jig, okay?
Yes.
To hold it in. Are you doing okay?
Mm-hmm.
All right. Yep. Can't give me price. Now again, you only could do 2 at a time because these are interlocking. Thank you very much, Luke, okay? Super. Oh my God, I got 6 hands now. Okay, so they're down, right, Luke?
Let me see. Can you move it?
No.
I think so.
No. Let's do this one. Okay, so we
This
got.
is good, huh?
Yeah, that's good. And this is good. Now the ones in the front will not be as hard as the back. Good. And there, oh my God, look, that's perfect. Super, super, super. And then we'll go ahead and. Now, you know, normally after I do this, I take radiographs to ascertain the fit. However, we tried these. Could you hear me, Angel? We tried these on before, so we took the x-rays to ascertain. You know what I'd like to do? Okay, let's go ahead the other. These are two.
You took it out?
Yeah, no, they're not.
Okay, so they all are fitting. Now we got the 4 implants left. Any questions while we're doing this, or I think you see the necessity of this pattern and a little bit of how delicate this is. If it would be a screw-retained prostheses, you really don't have to do this step. But when they're individualized, it makes it a little bit more difficult to orient the hexes within the implant system. And look, can you see this pretty clear? Could the audience see it on the screen?
See?
And you can see how, you know, I know that all of these implants are in the correct position by this composite all the way up to the gingiva, and then these are flush here. So the back 2 is the only 2 that we have. And let's see if we can get them, okay?
I can hold these. Can you? Okay.
And see if I could get open a little bit more. Super, super girl. We have them all off.
Can you chin down a little bit, Hana? Chin
Yeah.
down.
Now,
You see?
we could ascertain all the fit
Angelo,
here.
see?
Yes.
Okay.
Okay, let's go ahead now. We'll take them off. And that.
No.
That's
Chin
it?
down a little bit.
Yes.
Okay, now
Thank you.
we have
Yes.
all the
Yes.
abutments just hand tightened, and can you see this, okay?
Yes.
Okay, now the grand finale. Let's go ahead and then we're to put them in, check the occlusion, then we'll proceed with this, okay? Okay, the left side. This is the, but
Hana,
yeah, these are the.
down a little bit.
Thank you very much. Okay, that's in here.
A little chin up.
And that's right. And let's see the anterior.
So you see that one? Yes.
And then we'll go ahead in the anterior. We got the anterior.
Okay.
See?
Sure.
Yeah, a little chin down.
And then these are, which ones are which, huh?
This is first.
How do you know?
I made it.
How do you know something? Say what? Turn this, and then the last one. Notice that he put, Luke, just to describe a little bit of the beautiful work here. You put a little pink porcelain to
Well,
break
I-
up the length. Is that
I'm
right?
trying to imitate the gum effect, but I cannot put too much. But I put a little solder in the between the teeth, just give them more natural appearance.
Okay,
Can
now
you
we
bite,
have,
Hana? All right, chin down.
okay, now we have Hana completed, okay?
Okay.
I won't let her talk right now because what I'm going to do, we have a nice aesthetic. Luke and I tried it in. We look in the bisque try-in. Occlusion I'll check in a little bit. We have a nice posterior coupling. We used 8 millimeter articulating paper bilaterally and slight cuspid glides with no posterior interferences, contralateral interferences. Okay, any questions at this point here? Okay, so we have Hana.
And Dr. Caruso, actually you did was collaborate the lower dental teeth.
Yeah, we equilibrated the Veneers lower teeth slightly. We may, at subsequent recall, see Hana next week, etc., and do a little fine tuning of the lower and the uppers. Now, what I want to do is to go ahead and take this off, open wide.
I think some people could want to see.
Well, you're going to see it after it's all completed anyway, okay? Now we ascertain the fit, the aesthetics. Two ways of doing this. I have an electric torque driver at my office, or this one, which is at 30 Newton per centimeter, okay? So what I'll go ahead and, Otto, would you do me a favor, is I'm going to go ahead and start torquing them in from the back, okay? Not engaging the screw yet. Okay, at 30 newtons at that point. And back. And I want this one to come out here. So now we lock these in.
The recommended torque for all the bio horizons is 30.
The second one is fine. Tell me again.
For all of them, it's 30 newtons, yes.
How about the new 3.0?
Even the 3.0.
Okay. Do you advise? Well, I think it's an individual preference, but do you?
They're stretched out, and I think that once they're stretched by torquing, I would just, as an insurance policy, it's a very small price to pay to make sure that you're getting the optimum, preload on these screws.
Why were these made? Now, years back, they had gold screws, right?
Right.
And why? What was the philosophy of gold screws years back?
What was the philosophy of gold screws? I think, well, because they're a lot, because gold being as soft as it is, that was the whole goal, is to be able to torque these to a certain level, because the screw, when it is stretched, is what actually creates the clamping force. Okay?
The screw stretching.
Yes, actually, that's exactly right. By the screws stretching between the two parts is what created that load that allowed them to torque it to a particular value. Now, over time, they've coated screws with different types of materials. And, this screw that we use is the same screw design that actually NASA uses. So we feel pretty confident that this screw is a good design.
How about with that? Okay, Angela, could you just show this here? I have all of them torqued in, okay? Look at the nice tissue response that we have. Tissue response is very nice. Oral hygiene. Luke, I want you to mention a little bit about oral hygiene, because I know the members of the audience. Let's go ahead and cement it, and you could start talking about how are you going to help me have Hana utilize oral hygiene by your design. Is it from the labial?
Well, it's labials underneath too. Usually, doctor cannot provide convex tissue all the time.
Are you gonna put
So which means I have to little trim down, which is our model, tissue area. So my final restoration trying to get the convex, and then little minimize from facial to lingual side, which means more lingual side, so to make narrow.
Okay.
Okay.
No.
There are many choices of tempers, and would you just mention about this temper right quickly?
Sure.
Okay.
This is a new product for GC, which is a glass ionomer temporary cement
Let's put
for
the
long-term,
permanent.
where you need to retrieve a case. So it's being utilized in implant dentistry. It has all the properties of your standard glass ionomer cement, but there's a humectant. Thank you. There's a humectant that's added to the formula to make it so that it keeps it stable for as long as you need to have it in there. But when you're ready to retrieve it,
Just a little bit,
then you
right?
can make a cohesive failure. So your technique will be the same as you use all your other glass ionomer cements, and you will want to probably use a little bit of Vaseline if you have an area where you want to be able to clean it off easier, because it's going to want to bond, certainly, like glass ionomers do. So a little light coating of Vaseline on the prep will help you remove the old cement once you need to retrieve that particular restoration. But it releases fluoride like all of our glass ionomer cements do, so that protects the underlying tooth if there is vital tooth in there. And you won't get sometimes black lines that form if you're doing temporization with your standard temporary materials. You won't get that either, so it becomes a little bit antimicrobial, antibacterial as well. So, and sensitivity won't be an issue either. So it's still utilized in this delivery. So those of you that know about this paste pack system, it's done just like our Fuji Sem or some of our other cartridge delivery materials. So if you want to see this, I don't know if they're going to use it or not, but if you want to see it mixed and all that, we can do that later when he's all finished.
I want you to talk about this one, because we're using this GC Temporary Advantage, which is usual free.
Right.
Could you talk about it a little bit of that?
Sure, and then you have your standard non-usual temporary cement, like many of the products that are available to us to date, in a syringe that has an auto-mix tip. The cleanup on that product is really nice. The unique factors in that particular chemistry is it's your standard non-usual temporary cement, and it sets rather quickly, which is nice, but when you do remove it, it comes off clean. Most often all the temporary cement is inside your crown and everything, there's nothing left on the tooth. And more importantly, there's 3 added ingredients, 2 of which are going to help you a great deal. There's fluoride added to the formula, which really does a whole lot of nothing. There is chlorhexidine added to keep it antibacterial as well. And then potassium nitrate to keep it sensitive free. So it's really a nice little formula that you have, and become quite popular. The delivery is really what a lot of people like about it too, and there are other products on the market that are delivered in the same fashion. So if you want to get away from the messy tampon tubes, this is another alternative for you too.
Okay, the reason, obviously, you know the reason why some ferment or whatever temporary you're going to put to prevent disturbance of that screw, okay, is needed. And we'll go ahead and take a little bit more, and then we'll take a Q-tip with water. And Luke, you asked the question. What was the question?
I mean, maybe you can explain your...
Oh, I think he understands that we're putting ferment into the little access holes. And Angela, could they see this well?
Yes, yes.
Is this wet?
Yeah.
Yes.
No, we don't want to put too much in there. Hot always gives me too much. Okay, after this, I want you to light here. Okay? Now the last thing we're going to do, we're going to cement this in. Then we're going to have, I'll come out there and answer any questions or so. And then Aita is going to take off all of the temporary cement, okay? Hana is going to go in the little ladies' room, and she's going to see this for the first time. But I'll let you see it just right after cementation. And then we'll talk to her. And I think it went well. It's 1:45. So, and then the anterior, we go over from here to here. That's fine. And the individuals, I know they're going to be okay. Okay. So let's go ahead. Now it is Aida's turn to dry those off, and now we're going to cement those in. Okay. Okay. Now we're finalizing the case with the temporary cement. You know, I always say that there's little hydraulic force on these, and if I just keep my fingers off of them, the viscosity of that cement wants to pull or push it up. Hana, could you hold the ridge up? Well, I'm going to put this in, and then I'm going to make sure it's in the right place, right? Yeah. And I'm going to hold this. Ada, can you do me, because I'm going to hold this over here, can you then put the first one, second one, and third one for me? I don't want to release the, and then she's going to hold. And you go ahead with the others.
Actually, she was dentist, right?
It's what?
She was dentist.
You know, Aida is so good with her hands, and she's from Bosnia, and I always, and I'm still not convinced whether she wasn't a dentist out there. She is absolutely fantastic. I couldn't do these cases without both Lori and with Aida. So Aida just tells me how to do it. I asked her what kind of practice she has, but she won't tell me what it is. So we pretty much are set now. The whole idea is that I want to keep this under pressure while it is, and I'll hold this here if you could get the last one in, Aida. If not, I could get it in if you can. Great, okay. You want to hold this? Okay, so we have her. Could you time this, Luke, or you have, Angela, a timer there?
Yes.
If you time this, I'm going to hold this for about 3 minutes, okay?